Surprise billing affects 55 million Americans. That's 1 in 6 people. Next slide, please. Defaults on these unexpected bills are the #1 cause of consumer bankruptcy in the United States. Next slide, please. So what is surprise billing? Surprise billing is when healthcare consumers unknowingly use healthcare services that are not in-network or covered by their insurance, and then they are billed hundreds of thousands of dollars for using these out-of-network services. Next slide. Why does this happen? Simply because the industry still uses insurance cards that provide no real-time value, while still requiring hospitals and physicians to make manual phone calls and faxing to the insurer to obtain confirmation of network coverage, a tedious process that can take between 2 and 4 business days to complete. Surprise billing has become such a hot-button topic that the U.S. government has created a committee to come up with a solution. Unfortunately, their proposed legislation to completely exempt the consumer from surprise billing will actually cause hospitals and physicians to lose money, driving up their costs, in turn driving up the cost of insurance premiums, and ironically driving up the cost for every consumer. So I'd like to use an analogy. Let's say, for example, the fitness industry operated like the healthcare industry. Say you go to the gym, you hand them a non-scannable membership card, and they tell you, you can work out here, but it may take us between 2 and 4 days to find out if our gym is in your network. After 3 days of working out, the gym comes back and tells you, sorry, you are not a member at this gym, and we charge non-members $3,000 a day to work out, handing you a $9,000 bill. This is how the healthcare industry operates. Surprise! So, in this analogy is our simple solution to a so-called complex and costly problem. Next slide, please. That's okay. My name is Jessica Cruz, and I'm a part of the founding team at Med-Rok Systems, Inc., who has created Admitscan. My partner, Rachel Phillips, is the founder of Med-Rok Systems and a registered nurse with over 30 years of industry experience. Great. Admitscan is the previous one was good. Admitscan is a patent-pending QR code system that is interfaced with the insurer that when scanned in any hospital admitting department or emergency room immediately reveals network status of a patient. In addition, it also notifies the payer of the patient's and the patient's primary care physician of ER visits and hospital admissions in real time, improving outcomes and allowing for telehealth patient referrals. Another valuable function of Admitscan is automated repatriation, which is the process of returning out-of-network patients back to their in-network hospitals and physicians. Admitscan connects in and out-of-network hospitals, allowing for patients to be transferred back to an in-network hospital within 30 minutes versus 2 days. Next slide, please. The opportunity for Admitscan to impact the healthcare industry lies in the 294 million Americans who are insured in the United States. Our initial targets are the insurance companies who insure the 37.3 million Californians and the California hospitals who admit 3.4 million patients annually. Next slide, please. Admitscan costs insurance companies $1 per month per member. For a family of 4 people, it costs insurance companies only $48 a year to protect them from surprise billing. Hospitals will be charged $2.50 per scan, protecting them from millions of out-of-network defaults per year, while decreasing workforce requirements. We currently have a letter. Next slide, please. Next slide, please. We currently have a letter of intent from AltaCorp, whom has 20 hospitals nationwide and actually 5 in Southern California that we're targeting. And we have a letter of intent from Martin Luther King Hospital in Los Angeles. Our competition, which includes eCensus, Passport, Epic, Allscripts, and Cerner, do not actually provide an admissions process that protects patients or hospitals against out-of-network healthcare charges. Med-Rok's Admitscan team consists of healthcare and healthcare IT professionals with more than 30 years of diverse healthcare experience. We're asking $200,000 to put together a 4-month pilot with AltaCorp hospitals and the LA Care Insured. Affordable, intelligent technology, affordable, intelligent healthcare. Thank you.
The 2019 Converge to Accelerate conference is brought to you by IEEE, the world's largest technical professional organization for the advancement of technology, Boehringer Ingelheim, passionately working to improve healthcare, NASCO, advancing digital health together, IPSI US, the Association of Independent Workers, for one, for all, Partners in Digital Health, publishers of the forward-reaching blockchain in healthcare today and telehealth and medicine.